All right. So, my name is Faith. Thanks for being with me today, Dr. Weaver. As you may or may not know, National Black HIV/AIDS Awareness Day is on February 7th. And so, to spread awareness and just to really bring light in honor of this, we are having conversations with our Black counterparts about myths and facts regarding HIV and AIDS.
Okay.
So, what we're going to do here is I'll give you a statement, and then after the statement, let me know if you think this is a myth or a fact, and then just a little bit of supplement as to why, or what you know or what you don't know for that, okay?
All right.
Okay, let's get started. So, fact or myth? It is possible to have sex with an HIV partner without acquiring the virus.
I think that's a fact.
Okay, and why do you think it's a fact?
Well, because, well, ask me that question again. Let me see if I'm ask me again. I'm sorry, messing up your
That's
recording.
fine. All right. So is it possible to have sex with someone who's
Mhm.
HIV positive
Right.
and not get the virus yourself if you're negative?
Yes, it's possible. I think that's a fact. Why? Because some people use contraceptives. You know, use protection, and as long as they don't, I guess I say transfer saliva or transfer bodily fluid, I think they're okay. Now that's
Okay.
just my, thought on that.
Yeah, for sure. So, preventive methods, or whether it be abstinence, not
Right,
partaking in sex or not any IV drug usage, avoiding that.
right.
But actually, if that individual who's HIV positive, if they take their medications as prescribed, usually once a day,
Hmm.
and their viral load is so low in their body that even a test can't detect it, and
Hmm.
they're quote unquote undetectable, it's
Right.
possible that then they don't transmit it.
Okay.
So it's called undetectable equals untransmittable.
Gotcha.
And so for partners who, one may be HIV positive, living with the virus, and the other doesn't have HIV,
Hmm.
it's quite possible that as long as they're compliant and they're doing their part, they will not transmit that virus sexually. So that's without a condom even.
Okay.
So the risk is so low, like less than 1% chance that
Mm.
they would transmit it. And so
Oh,
this is huge because it really changes the game as far as what some people are so fearful of, and in relationships that people are cautious of.
right.
And
Right.
there's other methods of prevention too that I'll probably come across when we ask, but that's a huge campaign right now. So I did want to emphasize that.
Okay.
Okay, so
Sounds
you
good.
got that right. That was a fact. So that's you
Thank you.
you hit it
Thank
on
you.
the head. It's a fact.
Oh, thank you. Thank you.
All right. What about fact or myth? Most people who become newly infected with HIV don't know it.
I think that's a fact as well.
All right. Why do you say that?
Because how do you know? How do you get that unless you go get tested or how would you know that you have the virus if you don't get tested? So I'm saying that, if they don't get tested, then they don't know. But what would cause them to go get tested though? That's my question.
Yeah, and that's good because you're emphasizing what you're saying is that getting tested is really important, and
Right.
and knowing your status is important. And also because sometimes if someone does have some minor symptoms, they will
Hmm.
never manifest and say, "Oh, this is HIV," it'll never be glaringly
Right.
obvious. It could
Exactly.
be a sinus infection, it could be a cold that doesn't go away.
Right.
So these things are not obvious. So yes, in fact, it is a fact. Most people are unaware, and that is also why, or most often when the virus is transmitted, because someone would transmit it unknowingly
Right.
because they haven't been tested. And so that's where we're trying to hone in on knowing your status so that you can prevent transmission and spread.
Right. Right.
So
Good.
you got that one right too. That's two for
Thank you.
two.
All right. All right. I'm on a
Uh,
roll.
Yes, you are. Okay. How about this? Myth or fact? HIV always leads to AIDS.
HIV always leads to AIDS. I
Mhm.
think that's a myth.
All right.
Why? Because sometimes you can have the virus, the HIV virus, but it doesn't turn into AIDS. If I understand correctly. So I think that's a myth.
think you do. So do you mind elaborating on what you're comfortable with about how they're different?
Well, if you have the HIV virus, but I'm not really, I'm not really well versed on this, right? Because I really don't. I'm just going by what I've heard other people say. If you have the virus, it doesn't mean like it might not turn into AIDS. That's what I heard. It's sometimes the virus will let you be more acceptable to having AIDS, but it doesn't necessarily mean that you will have AIDS. That's what I've been told.
No, and you're
I don't.
exactly right. You're exactly right. You have the virus, and then AIDS is actually the progression. So what happens when your immune system sort of tanks, and then
Right.
all these infections and a lot of other issues come about, and that syndrome, those
Mhm.
infections, your immune system kind of collapsing,
Okay.
that's what AIDS is.
Okay.
And that's acquired immunodeficiency syndrome.
Right.
And then the virus is human immunodeficiency virus. So you
Mm-hmm.
can have a virus, but you might not get the syndrome. But if you have the syndrome, you will always have the virus, if that
Right.
makes sense.
Makes quick, well, quite good sense.
Okay, yeah, but you got it right and you distinguished them well. So that's 3 for 3.
Okay.
Um, we're almost there.
Okay.
I'm curious to see. I have one more for you.
Mm-hmm.
All right, so all right, so this one is kind of similar to a previous question, but a little different. I want to see if I can go a little deeper here.
Okay.
So, condoms and abstinence are the only methods of preventing HIV.
Condom. Okay. Abstinence is the only method. I would say that's a myth as well.
All right, why do you say that?
Oh, because say for instance, you might, you know, somebody, somebody cut themselves, and then you might touch that blood or whatever. And you have also might have a cut or something on your hand, and that way you can, it can be transmitted. I
Mhm.
thought, I think so. Yeah. So I don't. That's abstinence. Oh, wait a minute. Abstinence and
Condoms
condoms. Right.
and so bloodborne pathogens, you're saying like being protective with like your gloving techniques and
Right.
avoiding, okay. Yes, blood to blood transmission, usually through percutaneous or through like a needle stick is usually
Right.
it.
Okay.
If you don't have any sort of mucosal or membrane open and you touch
Hmm.
the blood,
Hmm.
technically it wouldn't be transmitted that way.
Right.
But
Right.
yes, you're right. So especially in healthcare settings,
Hmm.
yes, being, protective where can't call it right now, but yes, is important.
Right.
But in
Hmm.
addition to that, there's
Hmm.
another huge way to prevent it. So it's called PrEP. Have you heard of PrEP?
I've heard of that. I've heard of that, but
Okay, a lot of
I don't know the
commercials,
details of
maybe.
it. Yeah.
Yeah, so it
Commercial.
stands for pre-exposure prophylaxis or
Okay.
PrEP. So
Okay.
meaning that before you even are exposed, you can
Hmm.
take a tablet once a day
Mm.
to prevent that exposure. So
Mm.
that in a oftentimes, not oftentimes, this is usually recommended for those who may be in situations that they're at increased risk of HIV. So
Okay.
maybe if their partner has HIV,
Mm.
or if they exchange money for sex, or they're in environments where they can't control, moments or exposures like this.
Right.
These are some ideal situations.
Okay.
So they can take one tablet once a day and
Hmm.
it's been shown about 99% effective as far
Oh,
as sexual exposure to prevent it.
okay.
So kind of like we was talking about earlier, if someone is HIV positive, they take their medications every day, they can protect their partner, but the other person, they can also take a tablet and protect themselves too. So
Okay.
we have two modalities here. So really cool, but PrEP is a one tablet a day.
Hmm.
Um, and so long term, it seemed to be it's effective, but our problem or the issue, especially in our community or in the
Hmm.
Black community, is getting the word out
Right.
and actually letting people know and getting access to care and to this medication. So
Right.
screening for it to see is it appropriate,
Mhm.
So that's where we're at with that. So it's called PrEP. So
Yeah,
you'd heard of it, but not
I heard
exactly
of it.
sure of it.
Right, right.
All right. So something, does that make sense? I kind of said a
It
lot. I
makes
want to make
it,
sure.
it makes sense. It makes sense, you know, and just think about when AIDS first came out, it was, you know, it was detrimental. It was killing people left and right. But now how, you know, you've come this far now. I mean, modern technology has really, you know, made things much better for people with that you know, have AIDS now. So yeah, it's mind blowing. It really is because like I said, when it like in the 80s when it first came out, it was, I mean, killing by the droves. You know, again, you know, and like you said, a lot of our community don't know because we don't get the word is not given to us. We don't get the information that we need. And because of that, and I think we suffer the most because the lack of information.
Yeah, and I'm glad you said that because I was going to ask for your insight and you mentioned it. Do you have anything else that you've seen just in your lifetime that even as a Black male, that as far as awareness, HIV, AIDS, like anything else you can kind of let us know about?
Yeah, I think that I always had the preconception that if you were homosexual, you know, you was destined to, you know, be, you know, have AIDS. If you're heterosexual, no, well, it wasn't, you know, you couldn't do it. But I found out that that's not true as well. Heterosexuals can get it because they can do, like I said, needle prick or whatever. They can come in, be exposed to it, and then they're infected, and not because they partook in any type of homosexual activity, but they, you know, drugs. They were, you know, using needles with a person that they didn't know they had AIDS, and you know. But yeah, I learned that a lot because a lot of time I said, well, that's just for the gay community, but it's not. It's not.
That's great. Yeah, and a lot of it because of in which it's very common, that thought process. And so a lot of the conversation and letting debunking a lot of these myths and also
Mhm.
stigmas surrounding it that it is a gay disease,
Right,
or it's a Black disease, even,
right,
Black or minorities,
right.
is where we give facts and we also state and explain why. Like you said, access, other determinants, social determinants of health
Right.
within our community. And so doing our part too to just have exchange and conversations and taking the elephant out of the room or pulling the
Yeah,
air out of the bag.
yeah, yeah.
So that is why I'm having this conversation in
Hmm.
truth. So, and just to give you a statistic, about 13%, we make up about 13% of the population in the US, but we
Right.
account for nearly half, about 42% of infections of HIV. Now, that's in 2019, but nonetheless, it still remains large. So there's
I
a
have a
lot of
question.
work we still have to do.
Yeah, I have a question for you.
Mhm.
Why is that? So, you know, it's like the Black community always have we're the lowest in, you know, in population, but we like be the greatest when it comes to diseases and, you know,
Mhm.
things of that sort. Why is that? You know, what can we do to stop that? You know, I mean, as African Americans, what can we do to stop that?
I mean, the plane is really large as far as, what kind of disparities exist depending on the disease, but
Mhm.
when it comes to something like with HIV, there's a huge social component, a social and cultural component. And
Okay.
so male to male sexual contact accounts for a lot of those infections. And
Okay.
so for some males, they may be not comfortable talking to their family about, who they have relationships with and their
Right.
gender, their identity. And
Right.
because of that, that's right there is a stepping stone away from having a comfortable conversation, maybe not doing things in private or
Yeah.
without judgment. And
Right.
that can be a
Right.
catalyst
Mhm.
um for relationships that are maybe unhealthy or relationships that are not safe.
Okay.
So within this small, and of course that this isn't my niche particularly, but I
Mhm.
do know that within populations who are disproportionately affected, Black ones, is is Black male to male sexual contact.
Right. Right.
So within that, there's just a lot of judgment and biases. And so access to care is also, so if they're not informed of trials or they're not aware of new medications that they can prevent, their partner from acquiring,
Mhm.
who's telling them? If
Right.
we as their counterparts don't know it, and if their physician or doctor, doesn't tell them,
Right.
then so yeah, either misinformation or uninformed,
Mhm.
or the discomfort of having the conversation to ask, you
Right.
know.
Yeah, that's true.
So
Yeah.
all of that bundled together, but starting with the facts, starting with conversations, and really, I don't want to say simplifying them, but
Mhm.
normalizing it is
Right.
is
Right.
also a big part of that stigma, and what we remember is not what it is today.
That's
The
true.
you know the death tolls and who was affected, it looks very different. It's
Right.
actually classified as a chronic disease, so
Mm.
comparably to diabetes. So if someone
Okay.
were to have an amputation, or that they could have a lot more adverse effects than, say, someone who takes their one tablet a day living with HIV.
Right.
It's almost comparable, taking less medications at that. So there's still a lot to talk about, and a lot to for us all to learn. But yeah, thanks. That was a great question. I hope that I answered some of it.
Yes, you did. Yes, you did. Yes, you did.
Okay.
Yeah.
So thank you for your insight also, and really just being vulnerable enough to, explain how you felt, what you thought, what
Right.
um, because it matters and it helps. So that's a step forward. So I thank you for your time and
Yeah.
your
Thank you.
words, and that will wrap it up for us.
All right. Well, you have a blessed one now.
All right, thanks, Dr. Weaver.
Bye bye.
Bye-bye.